Last week in Geneva we had the Global Partners Meeting for Neglected Tropical Diseases, of which the aim was to take stock of progress achieved over the last 10 years and particularly over the last 5 years. Since 2012, since the WHO launched its NTD roadmap, and various partners have rallied around that roadmap, signing the London Declaration. This has led to a global NTD alliance, an informal global NTD alliance that has supported WHO with the implementation of this roadmap. In 2015 alone, we reached 1 billion people with NTD interventions. That is a priori the poorest people who are affected by these poverty-related diseases. Also, to give you a few other examples, visceral leishmaniasis, a killing disease, has almost been eliminated in Southeast Asia. Human African trypanosomiasis, or sleeping sickness, is at its lowest level ever, with less than 3,000 cases detected yearly now, and with 3,000 cases detected in 2015. This meeting here in Jakarta is very timely, given the fact that it follows the global meeting we had in Geneva last week. With regard to the Southeast Asia region, this region is leading the way in terms of large-scale preventive treatment, particularly for lymphatic filariasis. Another disease where this region is showing the way is yaws. Last year, WHO recognized interruption of transmission of yaws in India. That has solicited a lot of international interest, to the extent that WHO globally was able to mobilize additional resources under the form of a donation of medicine as well as money for implementation, as was announced last week in the Global Partners Meeting on Neglected Tropical Diseases. We are very grateful to Dr. Poonam Singh, Regional Director of the Southeast Asia region, for prioritizing neglected tropical diseases at the regional level and making this a flagship program for the region. This will allow countries to further accelerate progress towards the 2020 goals. We particularly appreciate the call for action that was launched here in the Jakarta meeting. That will allow countries to accelerate interventions and reach the NTD roadmap target well ahead of the deadline of 2020.